Hello everyone, welcome to another episode of Learning on SmartNursing. Okay, my name is Miss Evie, and as usual today we want to do some nursing tutorials. This is SmartNursing, where we talk about nursing, lifestyle tutorials, immigration, career opportunities, and then everything else in between. Okay, so today we want to talk about acid-base imbalance. So what is acid-base imbalance? Okay, I know you've heard of the metabolic acidosis, metabolic alkalosis, respiratory acidosis, and respiratory alkalosis. So what exactly do they mean and how do they come about? So the normal pH of the body is from 3.5 to 5. So what that means is that your pH determines your acid-base balance. Okay, so it doesn't have to go below 3.5 and then it doesn't have to be above 0.5. If it's below 3.5, it is termed as acidosis, and then above 0.5 is alkalosis. Okay, and so depending on the component that is causing the imbalance, then it becomes a respiratory or metabolic. So we have carbon dioxide, which is mainly acid in this context. Okay, and then we have bicarb, which is mainly base. The bicarb actually tends to buffer the situation, and then the carbon dioxide will make it acidic. All right, so if it's coming from carbon dioxide, is the disorder or the imbalance is because of a carbon dioxide problem, then it will become a respiratory issue, and if it's a bicarb problem, it will become a metabolic issue. Okay, so the normal pH is 3.5, and then the normal carbon dioxide is also 35 to 75. Then the normal bicarb is 22 to 26. Okay, so whichever way it goes, it will determine what is causing the problem. Now, one thing we also need to know is that the system or the body in its own way tries to compensate each other. So if it's a respiratory problem, you will see that the metabolic or the kidney will tend to respond. But usually in this case, if the kidney is responding, it acts slowly to compensate. So maybe you have a respiratory problem, be it an acidosis or an alkalosis, you will see that the kidney will try to respond, but it usually responds slowly, and so it can take hours to days to be able to compensate. It will adjust the bicarb depending on what the issue was. Okay, if it was a respiratory acidosis, then it will adjust the bicarb so that it will be base. So there will be a metabolic alkalosis, which will try to compensate a respiratory acidosis. And if it's a respiratory alkalosis, then there will be a metabolic acidosis in order to compensate. Okay, in the same way, if it was a metabolic issue, the respiratory adjustment will come in order to compensate, and usually these ones are very fast. When respiratory issues are trying to compensate metabolic problems, it acts very fast within minutes to hours. Okay, but then why is this important? Why do we need to know about all these things? When you study your acid base imbalances, or when you are able to interpret the results, it will tell you how your ventilation is working, whether it is good or bad, how your lungs are responding, okay, how your metabolism system is, what are your respiratory issues. Now, in addition to that, it will help you to be able to monitor conditions. Okay, once you do a first test, what we call the ABGs, and watch out for that video where we will talk about or take you through the step-by-step, approach in interpreting ABGs. Okay, so when you are able to interpret, it will give you an idea of how your patient's condition is improving or is worsening. You're going to know your electrolytes, you're going to know your gases. Then you will be able to adjust. For example, if it was a ventilator issue, you're going to adjust your ventilator settings. Okay, maybe the patient came with sepsis, the patient came with DKA. Then you're going to know how your patient is responding to treatment and how to manage them. Okay, so basically acid-base imbalances, are determined by whether it's respiratory or whether it's metabolic. Okay, and then if it's respiratory, then it's going to come from carbon dioxide. If it's metabolic, it's going to come from bicarb. Okay, then if it's respiratory, your bicarb will come in from the metabolic side to compensate. If it's metabolic, you're going to have your respiratory coming in to compensate. Okay, so that is basically acid base imbalances.